Hi, welcome to Carolina Breast Friends YouTube. This is our fourth and final session for January. I'd like to introduce our speaker, Pam Dollar. She is a nurse practitioner specializing in sleep medicine at Novant Health, and she also happens to be my wonderful mother-in-law. So with that, I would love to welcome Pam and thank you for joining us today.
Thank you so much, Ashley. I appreciate you thinking about me and the opportunity to talk a little bit about something that I do most every day. There's a lot about sleep that we don't know, even though I work in it every day and have learned a lot about sleep. There are quite a few things about sleep that we're unaware of. We don't know things about sleep. We're making new innovations regarding sleep and finding out new things about sleep and how our body needs it and how our body works when we sleep. But there are some things that we do know about sleep, things that have been established for quite some time, and things that are tell us that sleep is not wasted time. How many of you have ever heard or thought, I know I have, that I didn't have to sleep, just look at all the things I could get done. So sometimes we think about sleep as wasted time. Sleep's not wasted. Sleep is so important. Sleep is as important to you as the meals that you eat. Some people take medicines every day. Sleep is as important to your health as the medicine that you take. So what does happen when we sleep? Why is it important? And what are we doing? Are we just lying there? And, is it just a waste? It's not. Sleep plays a vital role in our health. Helps us be healthier, helps our brain do work that it can only do while we're sleeping. We formulate memories, we cement learning while we're sleeping. Our bodies do a lot of important work. It's our body's time to do the cleanup work that it doesn't have time to do when we're awake and involved in other activities. And so sleep is very important for us. It helps regulate body functions. So our blood pressure and heart rate typically will drop while we're sleeping. And that allows our body to get a little rest from that higher heart rate and blood pressure that we experience in the daytime. And so that's very important. If the heart rate and blood pressure stay high through the night, that can actually lead to some other kinds of health problems. And so that can cause some problems for some patients. And so patients that we see, and we want to help them work through that, we help them get better sleep at night so that their heart rate will start to drop and they get into that deeper sleep where some of that important work starts happening. There are some hormones that our body makes that we only make at nighttime while we're sleeping. And so if we're shortchanging ourselves with sleep, then our bodies aren't making those hormones that we need that it only makes while we're sleeping. So those things are important to us. Our metabolism is regulated while we sleep. So you'll hear a lot of people say that that maintaining good, healthy body weight is important to have a good, healthy sleep pattern because metabolism is affected by our sleep. So the way our body uses and burns and stores fat is related to our sleep patterns. Also, some of those hormones that we make that regulate our satisfaction with our food gives us what the use is satiety. It makes us satisfied. Those chemicals and hormones are produced while we sleep. And so if we're not sleeping well, then we'll start to see some of those problems come about sometimes with metabolism. Our immune system is affected by our sleep. And so to have a more healthy immune system, a regular sleep pattern is very important. So all that's just telling us a little bit about why sleep's important, what we can do to help ourselves get better sleep. But I know that in this group, we're talking about some special circumstances regarding sleep. we all have some struggles making sure we get the right amount of sleep and get good sound sleep. But many of us in this audience will have some issues related to some cancer diagnoses, in particular breast cancer diagnoses. We do know that there is some particular connections with sleep problems, a problem that we typically call insomnia. Insomnia is a condition. The technical definition of insomnia is difficulty going to sleep or staying asleep. That's only the half of it. So going to sleep or staying asleep, and there's a disruption in daytime function. So sometimes we have trouble going to sleep or staying asleep, and the next day we're like, oh, it was a bad night. I think I'll probably sleep better tonight. And it doesn't necessarily interfere with our daytime function. But if that happens long enough and continues, then we will start to experience some disruption in our daytime function. We might start to feel more sleepy in the daytime. We might feel more fatigued in the daytime, not really as sharp in terms of our thinking. And so that can cause some real issues. In that case, that would meet the criteria for a diagnosis of insomnia, either going to sleep or difficulty staying asleep with an impaired daytime function. So that would be the definition of insomnia. So insomnia, in the case of breast cancer, there's a couple of interesting connections. In the case of any kind of cancer diagnosis or any kind of very stressful life circumstances, that can bring about anxiety, and anxiety can disrupt sleep. People, your mind's just going with all your daily activities. You finally decide that you're in the bed and you're ready to go to sleep. But now your mind, the only thing you can think about is that very stressful situation that you might be in. For some people, it might be a cancer diagnosis. For some people, maybe other kind of health diagnoses may cause some anxiety or other life circumstances that can sometimes cause anxiety. And that then can lead to difficulty going to sleep. For some people, they have difficulty staying asleep. They might wake up for whatever reason during the night. And then that can cause difficulty sleeping or staying asleep. In particular, a patient who is taking some particular medications associated with breast cancer, the tamoxifen and other related drugs, we know that one of the side effects of those drugs is insomnia. And so just the fact that someone is taking those medicines can lead to insomnia. Sometimes patients who are under treatments for breast cancer, the treatment itself can cause some side effects that lead to insomnia, difficulty sleeping at night, or sometimes we all can sometimes develop habits that later after the treatments can induce long-term insomnia. For instance, say you're having treatments that just really make you so very fatigued. And so that fatigue can lead us to believe, oh, a daytime nap would be great. And while you're having treatments, that might be something that is encouraged or even allowed or even encouraged. But sometimes even once those treatments are over, those habits are developed and we continue to take daytime naps. We do know that daytime napping can interrupt nighttime sleep. And so that in itself can eventually lead to poor sleep habits and some conditions of insomnia that are hard to deal with. So a lot of one thing that is interesting is that insomnia, there have been some studies that tell us that people who have insomnia, insomnia is itself a risk for developing breast cancer. So there are some people who, even before they find out their breast cancer diagnosis, they experience insomnia. And we do know that 80% of patients who are later to develop a diagnosis of breast cancer have had insomnia. So that's on the higher end. That goes anywhere from 40 to 80%, but sometimes there are quite a number of patients who have eventually a diagnosis of breast cancer have had problems with insomnia in the past. And so what do we do if that is the case for us? Are there things that we can do to help alleviate insomnia? We do encourage patients to keep a good sleep pattern. Try that in spite of all the challenges that that you're going through when you have breast cancer and you're going through some breast cancer treatments, because those kind of habits and patterns are important. Now, we may say, and I have patients tell me this sometimes, oh, but I tried that one time and it didn't work. I'll say that even if it's not working, the insomnia can be miserable. So it's still good to develop those patterns and try to follow them, even though you don't see a day-to-day improvement in insomnia, because those good patterns will serve you well even after your treatments are finished and you go back to a more, what we would consider, we might call it sometimes a normal life circumstance where you're not having those treatments and not going through those stressful times. So your good sleep at night is established sometimes by what you do in the daytime. So I encourage people to try to stay as busy as your energy level will allow and your schedule, so that when you reach your bedtime, you're actually ready for sleep. The way we prepare for sleep is staying active in the daytime. Now, sometimes that activity, when you're feeling good and you're healthy, then that activity might be running a 5K. Or that activity in some cases is getting out of bed, doing your personal care, maybe doing a couple of things around the house, and then sitting down to take a rest. But whatever your activity will allow you to do, I'd encourage you to try to keep that up, because that in essence prepares us for sleep at night. Also, avoiding napping in the daytime, if at all possible, can sometimes help you with sleep. There are several different drivers for sleep, we call them. One driver for sleep is a sleep debt. So we build up a sleep debt during the daytime when we're not sleeping. So if we nap, though, we're using out of that bank account and we're not building up a sleep debt like we should. And so it gets to bedtime and, hey, we've taken a few naps or maybe one long nap and we're not sleepy. And so it's hard to sleep at night. So I would encourage you to, consider your fatigue level and what you're going through, but also try to remember that, maybe a rest instead of a nap, or a nap where you actually set a timer and you time yourself so that you're not sleeping hours and hours and hours throughout the day and getting, turning into, sometimes the newborns will do that. Their days and nights get mixed up. And sometimes we can do that too. With some of our patterns, we can allow that to happen. Now, just a couple more things about things to remember to try to improve your sleep would be to maintain a regular sleep schedule. So even if you don't have other circumstances that demand you to be up and out of bed at a particular time or to go to bed at a particular time, I think we all should still have a bedtime. We don't have our parents telling us what time we have to go to bed any longer, but we should all establish a bedtime, not because of some outside force, but because we want to feel good. And we know that a regular bedtime is good for us. So choose a bedtime and then choose your wake time. Most people need anywhere from 7 to 9 hours of sleep to feel refreshed. Some people need more, other people need less. But the thing is trying to hone in on how much sleep is right for you. So you might start with 7 or 8, and then if you're establishing a good bedtime, getting a good 7 to 8 hours of sleep each night, and then you decide, oh, I don't need this much sleep. I wake up way before my scheduled bedtime or wake time. So instead, what you might need to do is shorten your sleep time. Other people might say, okay, I'm getting my 7 hours of sleep, but I'm still tired in the daytime. In that case, you might increase your sleep time. You either go to bed earlier or sleep a little later. So those are some ways to hone in to the right number of hours that any individual might need for their sleep. We also recommend that you only sleep and have other intimate activities while you're in your bed. So we do recommend no phone, no computers, no lighted tablets. Those things can stimulate our brain to make chemicals that cause us to be alert. Those alertness chemicals can prevent us from going to sleep. It can cause insomnia for us. So we need the light and dark, the changes in light and dark to trigger our circadian rhythm. That's the rhythm that regulates our sleep patterns. And so we need that light and dark to trigger our body to make chemicals that make us sleepy at night. And then also in the daytime, make chemicals that cause us to be alert in the daytime. So that's very important. I'd also encourage you to try to make your sleep environment as comfortable as possible. We know that we sleep better in a cooler environment. And so sometimes you might have to negotiate that with someone else in your household or somebody else in your bed to try to negotiate the temperature of the bedroom. But we do recommend a temperature of around 68, 69 degrees is ideal for sleep. And especially, for some of us with hot flashes and those kind of things, then that cool room can feel really great at certain times in the night. So having a good a cool temperature in your bedroom, as dark as possible in your bedroom is also helpful to help to initiate sleep and maintain sleep, and a quiet environment. Sometimes we don't have a lot of influence over whether our environment's quiet or not. There are other things going on in our house or next door or something like that. I recommend either a sound machine or a fan. Sometimes just a fan noise is enough to drown out a little environmental noise. I have people tell me, oh, I like the ocean sounds. And that can be soothing, but when that wave crashes just as you're dozing off to sleep, that may be just enough to wake you up. So I recommend something that's a little more monotonous, that doesn't change volume or tone while you're sleeping, so that there's nothing that stimulates your brain and wakes you up while you're sleeping. That way you might be able to stay asleep a little bit longer and maintain a good, healthy sleep. Now, we try all those good habits, and then sometimes we still have problems sleeping. So in that case, we might recommend some additional improvements to try to help you sleep. So in our sleep habits, we might recommend improvements. I'll tell you that we often rely on medicines, and we have for years. In the last few years, all the professional sleep organizations have recommended a different treatment in the treatment of chronic sleep problems or insomnia. So this treatment is called cognitive behavioral therapy for insomnia. So it's a counseling or it's a psychological therapy that's used to help us understand about our sleep and maintain good sleep habits and help us develop patterns that go a long way to helping us sleep better. Most of the research around cognitive behavioral therapy for insomnia, or CBTI, shows that CBTI is as effective as medicine in the short term to help with sleep, and it's more effective than medicine in the long term for people with chronic insomnia that make it hard to go to sleep and stay asleep. So I would recommend CBTI as a good treatment for insomnia. Sometimes even in spite of good sleep habits and CBTI, people still have problems sleeping. So in that case, I would recommend some medications sometimes for my patients. There are some natural remedies that can be helpful for sleep. Some of those might include, for the short term, might include melatonin. We don't recommend regular melatonin over the long term, but an occasional use of melatonin can be helpful for people who have trouble going to sleep. Melatonin has a half-life, we call it in medicine. That means how long it stays in your body. Has a half-life of about 4 hours. So if you have trouble going to sleep, melatonin's a good solution. If you have trouble staying asleep, melatonin might not be the ideal solution because it might wear off just about the time you typically wake up anyway. So melatonin might not be the perfect solution in every case. Also, in addition to melatonin, is a natural substance called valerian root. Valerian root does have some clinical evidence to show that it helps with sleep, especially sleep initiation or going to sleep. So that's a good treatment that you might want to try. Magnesium has been shown to improve sleep. So those are all good natural remedies for sleep. And then, of course, there are other sleep medicines that your sleep provider or your primary care provider could prescribe. We always want to prescribe something that is as safe as possible in the lowest dose possible to give the effect that's necessary. So I do prescribe medicines. I like to try to avoid medicines if at all possible. Isn't that hard to believe that somebody in the medical field would want to avoid medicines? But it is an important thing to use medicine strategically because there is not a medicine that doesn't have a side effect. And so we definitely want to use it strategically and use it judiciously in cases where we're fairly certain that it can cause a benefit for patients. So I would be open to any of your questions if you might have anything.
So we did have 3 really great questions that came in that I think will be applicable to the recording. So I'm going to ask those and then we'll stop the recording and can ask any personal questions from there. But the first question is, what is the best use for prescription sleep aids like Ativan for nighttime insomnia, and what is a more holistic method? I think you just touched on a couple of those holistic methods, but can you give the best case scenario for the Ativan?
Yes, Ativan can be used short-term. It's a good medicine for short-term use. And typically the age range for Ativan would be over age 18 and under the age of 65. That class of medicine is, there's a warning for using that class of medicine for individuals over the age of 65.
Okay, perfect. Thank you. And then the second question pertains to the devices at night. And they were asking, what if you put your phone on dark mode?
That's wonderful. So the dark mode, sometimes there are blue screen modes on some tablets. I think the Kindle, there are some versions of the Kindle that has a blue screen mode. And what that does is that blocks out the most stimulating spectrum of light that is emitted. And so that can be helpful.
Thank you. And the last one is, could you expand on CBT and insomnia? Could you give us an example?
Yes. So CBT incorporates several different functions. It's about a 6-week program, and they look at good sleep habits, some of the things we've already discussed. It also, CBTI will many times ask the patient to keep a sleep diary. A sleep diary can be very important because a sleep diary helps us quantify how much sleep we're actually getting. So many of us, it's hard to judge the passage of time while we're sleeping. So it's really hard to know for certain how long we've slept. And so keeping a sleep diary can help give us a better number on that. And then that can also help lead us to another program that a CBTI therapist might use for a patient. And that would be a program called sleep consolidation. So we use sleep consolidation for some patients, and that's part of the CBTI program. And so sleep consolidation helps a patient put most of their sleep in one period of time. Now, there might be circumstances when you have to take, a short nap here, you're up for a few hours, a short nap there, you're up for a couple of hours, and then another length of time when you're sleeping. Now, on the short term, we can manage, we can get through if that has to happen. But for the long run, most of our sleep needs to be consolidated within a few hours during a 24-hour period. That's when we get the most benefit from our sleep. So that sleep consolidation program is also part of CBTI.
Perfect. Well, thank you so much, Pam, for your presentation today. At this time, we will go ahead and stop the recording so we can ask any personal questions. Again, thank you, Pam, for sharing your insight with us today.